Good morning. Thank you for joining CCN Connect Care Network. This is Consumers Doctor, Dr. Bengala. Today is November 2nd. And tomorrow is November 3rd, the election day. No matter what happens in politics, no matter who wins the race, it doesn't change the fundamentals. The way I see it, healthcare, we talk about empowering the average folks, empowering the Americans, consumers. A lot of people, they seem to underestimate the consumers for whatever the reason may be. But no matter what happens tomorrow with the elections, consumers ultimately will win. The way they will win by empowering the consumers. Even the Congress, the Senate, they have to look at who's going to benefit overall. So the way I see it, in the health coverage point of view, there are four categories, folks. Four categories. I'll make it short because there's a lot of work going on the parkway. In the risk segmentation, there are four categories. Number one is catastrophic coverage, which is only 1% of the claim for the population of 15% of the claim. It's only 1% of the claims among all the claims. So catastrophic coverage. So they need to base your premium based on how many people are exposed to the catastrophic. It's less than 1%. And number two, this is the most critical part, chronic illnesses. Chronic illnesses is 16% of the population have chronic illness, like hypertension, diabetes, obesity, you name it. Obesity is probably more, but chronic illnesses take 41% of the claims. Your premiums are based on 41% of the population submitting the bills. So if you belong to the category, this is where we need to work on how to lower the premium among chronic illness. It can be done with the technology. We can lower the premiums for people in the chronic illness category. And number three is at risk. Number three is at risk for acute injuries. Again, it's 16% of the population submitting 20% of the claims. At risk category is 16% of the population are at risk. Like obesity is one of them. Some people are exposed to the high risk. So third category is at risk, 16% of the population submitting 20% of the claim. The last but not the least is well category. This is where majority of the Americans fit in. 63% of the population are healthy, and their claims are less than 1%. And for them, obviously, the premiums have to be lower. This is where the actuarial, I got this information from Ron Bachman because he is an actuarial. He has been there for years. He has presented in Congress. He has dealt with both Democrats and Republicans. So his contention is the well category people, why do they have to share the burden of catastrophic, who are exposed to catastrophic illness or exposed to they have acute injuries, prone for acute. So why should they share This is where the well category people, the premiums have to be lower. If the premiums are lower, they can put money aside. I'm talking about 63% of the population, folks. And they can lower the premium by HDHP accounts. HDHP accounts. I renamed it. It's not a high deductible anymore. Health disclosure. Healthy pricing. I call that. Health disclosure, healthy pricing. So that way your premiums remain lower. Then whatever the money you save, you put aside into health solutions advantage. Not health savings. Health solutions advantage. The money which is put it into the health solutions advantages is yours, consumers. They can save money. They can put 300, 400, 500, whatever they save from the lower premium, put aside into health savings. Where does the government fit in all this? I'll tell you how government can fit in. For well folks, for well category, majority of this 160 million blue collar workers belong to the well category. They may have some family members with at risk or some chronic illnesses. We will address that later. But right now, well category, the premiums, employer subsidized plans, they should pay a lower premium for a family of 3 or 4, lower premium. Put money aside. It's mandated. Whatever money you're saving, contributed by the employer. Employee contributes 100, whatever the amount is, but rest of the money is contributed to the employer. That money goes into the health reimbursed accounts or health savings accounts. Health reimbursed accounts, they have liberalized it where employee has a portability and employee can make decisions for future use. So they have liberalized. So I would rather prefer health savings, health solutions advantage accounts, where it is portable and certain elements we have learned from the ACA, Affordable Care Act. Those elements they come out handy because they are the fundamentals. There are 4 fundamentals which ACA has looked into, and we are going to embrace all of them. All of them. What are they? Guaranteed health coverage. Yes. Number 1 is guaranteed. ACA has been promoting that. I think with this HDHP or health disclosure, healthy pricing method, everybody is guaranteed. It's like a home insurance policy, but this is an asset, folks. Health is an asset. You need to cover yourself. It's having a driver's license. You have an ID. You have to have a coverage. There's no ways, 2 ways about it. You can mandate that. Everybody should have a health coverage. And number 2, coverage of the pre-existing illness. Yes, it has to be addressed. President already said he's not going to sign it without that clause. It has to be. As a matter of fact, insurance companies have come to realize they need to cover. As a matter of fact, they're saying even if a person is diabetic, the insurance has to cover the diabetes part of it, even before the deductible kicks in. That will help the consumers. So people with chronic illnesses, they need to some, especially diabetes, has to be covered by the insurance. And number 3, which all agree upon, transition from parental coverage to the individual coverage. 26, everybody agrees with that. 26 is right time to. And number 4, unlimited lifetime maximum coverage. Unlimited lifetime insurance has to cover the unlimited. The premiums are based on whatever among the categories I mentioned, wherever they fit in, they need to have unlimited. And 5th, last but not the least, is comprehensive major medical coverage. Like comprehensive in the sense, any major surgeries, but You need to look into that. Whereas consumers have to pay the deductible part. As long as the consumers are responsible for the debt, consumers will get a little picky when it comes to the having major surgeries, major procedures, because they have to put their health solutions advantage accounts, HSA accounts. They need to initially pay up to whatever the deductible portion they have. So they're going to pick and choose. They're not going to just go and have surgery and waste their money. Believe me, once the consumers have an incentive to save money, they will save it. The beauty about this COVID-19 is the technology has come to the forefront, folks. Telemedicine, telehealth is here to stay. And I encourage people to participate in it. As a matter of fact, they're encouraging doctors to be transparent. Hospitals have to be transparent from January 1st. And they're giving more referrals to people who are transparent. They disclose their pricing before they visit the doctor, or they go to they talk to their doctor, their prices are transparent. Whatever the average telehealth, telemedicine costs around $20 to $29 per visit. It could be 10-15 minutes, but it's a good thing. They can talk to their doctor and lower the cost, and they can see them. And consumers have to pay for it initially because it's coming from their pocket. See, they have to be careful. So they have to be careful in saving the deductible portion. This is where the consumers are empowered. And the consumers have to decide which insurance companies. Again, insurance companies, this is where we need transparency more than anything else. Like home insurance or auto insurance, they need to have a competition, folks. Right now, in insurance, you're looking at, there's no competition. Like, look at the auto market. Look at the health insurance. I'm talking about home insurance. It's a tough competition, folks. We need to bring that health up front and compete for every dollar. Insurance companies have to earn it. Insurance companies will be in a better position, the way I see it, because, as I mentioned, you're talking about this at-risk, so-called at-risk. People who are at risk, people are smokers, people have diabetes, they have a congestive heart failure. This is where insurance companies can be creative. Give them, if people take this many courses, they will get discount. People with chronic illnesses, if somebody is diabetic. Where most of the people needs help is impaired group, so-called impaired or catastrophic group. This is where people need help from the government. This is where they need to give the so-called certificate of guaranteed coverage, especially people with chronic illnesses, people with at-risk exposure, and people with especially impaired group. This is where if a family member fits in one of these categories, they have to get a certificate of guaranteed coverage, where government will guarantee the payments to the insurance. I'm telling you, insurance companies will love to have their backup, so they will embrace these people with their, with a full coverage, whatever the coverage they need. But that initial deductible part, consumers have to pay for it. There's no two ways about it. Like any other home insurance, folks, you have to pay first deductible portion. If you're responsible, if you are responsible for your health, you will take care of their health and you will save money in that health solutions advantage accounts, like HSA accounts. People want to save money. People want to accumulate the wealth. This is a human tendency, folks. This is where consumers will come out ahead. Ultimately, consumers will demand transparency from insurance companies, hospitals, doctors, and even the surgeries. They have to. And one more thing, the hospitals under a lot of stress with the rules and regulations. Folks, they need to deregulate healthcare industry because they are choked. They are choked in the name of the public interest. Come on. We have these restaurants. It's a public interest. We have liberalized them. Why can't we liberalize some of these things in the healthcare? Why? What is it so different? When it comes to food, is equally important, but when it comes to health, there are different sets of regulations. Come on, we need to liberalize this. We need to liberate the hospitals and these doctors. You need to. Don't take me wrong. I love to have oversight. I want the oversight. Listen, I am the first one to suggest the oversight, but you really need to deregulate some of the aspects of the healthcare delivery. Otherwise, the hospital costs are burdensome for consumers. They can never go down. One of the reasons, building a hospital or having a hospital bed, I can't believe it costs about $10,000 to $12,000. It shouldn't be. They should be able to set up hospital bed for $2,000. Come on, this is ridiculous. These rules and regulations, I don't know who, these OSHPD rules and regulations. I understand in California they have to fill the criteria, seismic activity. But if it's a single story building, there's not much. Seismic activity wise, it should not be expensive. What I'm saying is, you need to have more facilities, more hubs, where they can compete openly for every dollar. Hospitals, hubs, doctors, they need to compete, not consolidation. Come on. Consolidation, those are gone, folks. Consolidation, it's not going to work in a consumer-driven society. These hospital mergers, group mergers, those days are gone. Their days are numbered, folks. You need more competition. Doctors are really good at innovating things, good at coming some creative ideas when it comes to patient care. Nobody can does better than doctors. Give them the tools what they need. Give them the tort reform. Come on, they need to limit the damages. It is cost prohibitive. Limit it to $250,000 award. And I would like to see the juries made up of healthcare professionals. Common folks don't understand the healthcare. They go by the emotions. You need to have healthcare professionals get involved in the jury. That's where I would like to see. That's where American Medical Association has to play an active role in selecting a jury. I get called for a jury for simple things. I would rather get called for anything to do with healthcare. I would love to be a part of it. There are some creative ideas which doctors have and nobody else. And this having a business is a lot of responsibility. This workman's comp, again, that needs to be addressed. These health insurance companies, if you're having a health coverage by the employer, make it easier for employer. Put together, combine the workman's comp with health coverage. You can insert some clauses for health work related injuries. You can incorporate in that. So that way employer pays one fee for both health and work related injuries. These are the things we need to address rather than creating too much regulations for the employer. Ultimately, we are looking at the interests of average Americans, folks. I would love to see people in the lower income category climb up the ladder, and give them the tools. There are ways to do it. In India, Prime Minister Modi, people could not afford insurance. You know what he did? He gave everybody across the board. I don't know how many. You're talking about 40 to 50% of the population. He gave a guaranteed 100,000 coverage. If people die in a family, they have the insurance to cover for day-to-day expenses. People live day-to-day. They don't have the money. But ideas like that, you need to have a guaranteed life insurance for lower income folks. People, you have to have some type of that will also is stimulus for the insurance companies, but government should give insurance for lower income folks. I like that idea. People who are in the streets, they don't have anything, they don't have any possessions, they should give them that coverage. I would like to see it happening in the United States. Would Democrats go for that? I'm not sure. They might embrace it. I would love to see people who are on the street, a mentally challenged or impaired group, give them the guaranteed coverage. That's where I would put that $3.8 trillion. They're wasting all that $3.8 trillion. And they're pumping the money into the wrong hands, folks. That money should come back to you, not to the middlemen. Intermediary organizations are ripping off the healthcare. I can see that happening over and over. If you put the consumers in front, consumers will drive the cost down, like food industry. This country has an excellent job in the food industry, and look at even retail. Look at Amazon's success story of Amazon. It is reverberating all over the world. One person could make a difference. I would like to see 1,000 Amazons coming up with a brilliant idea, especially in healthcare. We need to be the leaders, folks. If America wants to be a healthcare leader, they need to bring down the cost of the healthcare. How you do it? Give it back to the consumers. That's where the only person who can drive the cost down is the consumers, not the government. Government can't bring any cost down. Tell me where government has brought the cost down. Give me one single instance. I would love to see that. If the government has brought the cost down, I would love to hear that, folks. They have not brought the cost down. Creativity and mindset and individuals, consumers have brought the cost down. This is where human ingenuity, this is where America shines. I want America to be the number one in healthcare delivery, not 37th. After spending 18% of the GDP, and it has surpassed the defense budget, it's not acceptable. If the healthcare needs to be accessible to average Americans, bring down the cost, lower the cost, and give them the guaranteed insurance, life insurance to everybody on the street. People can't afford it. People in the, U.S. can do that. What Modi has done to the billions of people in India, if Modi could do it, I'm sure we can do it in U.S. Give them the life insurance, guaranteed life insurance for people on the street, impaired group. They don't have any assets. They don't have any possessions. We already have these people, with Social Security, we have all this. We can identify them in a heartbeat. It doesn't take much to give them 100,000 coverage for all folks in poverty. That will embolden. Healthcare is something that government has to provide the tools. Encourage the free market enterprise. I can bet you the healthcare cost, it doesn't have. I had this angioplasty for 23 hours stay. I received a bill. I don't blame anybody. This is where it is. I received a bill, $227,000. How could you justify? There's something wrong with it. People, if you're not getting it, there's something wrong with it. Healthcare stinks. The way I see it, it's not acceptable. It's not acceptable, and it has to be transparent. There's no way, if I knew that's going to be my bill, I wouldn't have gone to that place. This is where transparency is so critical. We can bring down the cost of the healthcare by bringing transparency and competition, health disclosure, healthy pricing, health solutions advantage is the way to go, folks. That's the way to go. Affordable Care Act is not about healthcare. It's all about control, folks. If you don't get it, I'm sorry. ACA is nothing to do with healthcare. As Abraham Lincoln said, this country, America, can never be invaded from outside. You know why? Freedom. If we falter on freedom, it could be. And I believe in Abraham Lincoln, and I believe in Ronald Reagan. As I said, America could be a shining city all over again. Yes, America will be number one healthcare provider. People should be coming to America to have the surgery, not the other way around, folks, which is not acceptable. If you do like this channel, CCN, Connect Care Network. This is Consumers Doctor, Dr. Bengala. And if you like this channel, subscribe, hit the notification button. You'll be able to see me live pretty soon. I'm working hard at it. And I would love to see chat with folks with difference of opinion. I always want to have the opinion from the public. This is where I would love to see that. And hopefully that will happen. Thank you again. This is Consumers Doctor, Dr. Bengala. We'll see you in the next episode.